and saying everybody deserves an opportunity to live beyond whatever condition that they find themselves in. So going into the Go First strategy, we are underneath the banner of the Regional Peacekeeper Collective. We have, as Derek had mentioned, we have several organizations that are going to be working on a real high intense service pillars that we're looking at. This is a model of comprehensive public safety health model that we're looking at, which is similar to CPR, but instead we're referring to as IPR, which is intervention, prevention, and restoration. So we have a host of folks in their particular expertise to make sure that they're operating out of the intervention piece, which is going to be working directly with the high-risk population of young folks. And we also going to have those who are going to be working with the prevention piece, which is the secondary support that will come with maybe the siblings and those who are at risk but not necessarily in risk of these certain aspects. And the restoration is really when we bleed this model with HMC and other different caregivers, where we provide that hospital care. We have a hospital-based interventionist that will come in and serve the population that is hit by gun violence injury. And so we're going to be providing a very intensive and rigorous prevention model in this particular aspect. And all the people who are involved in this, the Go First strategy, is being trained rigorously through mental health support. They're also being trained through critical incident response. So there's going to be deployment, there will be hotspot engagement, hotspot mapping. One of the things we talk about is also positive loitering, making sure that when we show up, we change the complexion of the environment. We make sure that sometimes we have to be able to bring the resources where the people are. Oftentimes they're not going to show up, so you have to bring it to them. We're also looking at the workforce that is going to be able to provide the skill sets for the young folks that we engage, so they can have the knowledge and also the toolkits to be able to interrupt the violence that they're exposed to. So we want to make sure that they have not only an understanding, but also the conflict resolution skills that bleeds into the practice of what we're all here today for. And this is also an initial 12-month pilot. So I want everybody to understand, as we're doing this work, we're operating underneath a pilot at this particular moment because of the lack of resources, and we also want to make sure that there's a heavy investment in the strategy. So this is the 12 months pilot that will focus on these efforts, working with those who are most at risk. And the terminology we use in with ourselves is also in risk, because at risk you can be on the fringes of a particular harm, but when you're in risk, is every single day. And with that, we're looking to make sure that we build up the support so they can avoid retaliation, further violence, and also provide wraparound services and care and support. The data that drives the work that we do is some of the data that we got from Deepika and HMC that looked at Harborview ER data, between 100 and 150 young people between the ages of 12 and 25, they have seen the emergency room for gun-related injuries. Gun-related injuries, 100 and 150, just think about that number. 100 to 150 young people, 12 years of age to 25. They have been, it's heart-wrenching for me just to think about that, right? Because we have, and just being honest with you, I have some personal accounts that, and I know Dom and I know Derek have personal accounts, and many of you guys as well, where you can actually put in the names and the faces of those 150 to those 12 to 25-year-olds. So I want you guys just to think about that. Also, we have data that comes from King County Prosecutor Attorney's Office in regards to 50 to about 50 or 80 young people on average who emerge in court cases in resulting with gun violence, whether they've been involved in gunshots or caught with a firearm. We also hear young folks in our groups of young people that we work with. They tell us all the time that it's much easier for them to get a gun than to land a job. So we have to be able to change that structurally in our environment. And also, we're looking at youth and community from the quality data tells us just how critical and life-saving having meaningful connections to caring adults who are credible messengers, as Derek was talking about. Those who can repair a spider web is only the spider itself. Once again, those who are closest to the problem is closer to the solution. But what we found in our research, they're often furthest removed from the resources. So this is what we're doing in this collaboration, and being able to connect these young folks with meaningful caring adults who can give them something other than what they're being exposed to currently. And also helping to develop a positive youth development, which is a critical element in this work. And this is the reason why we have formed the RPKC, which is the Regional Peacekeepers Collaborative, to be able to do this work in such a robust manner. And I'm honored to be in this space as we're looking at this from a comprehensive public health safety aspect and really taking on these critical issues. And I really appreciate that.